Dental implants and heart failure, safety, risks, and imaging considerations. Disclaimer: this article is for informational purposes only and is not a substitute for professional medical or dental advice, diagnosis, or treatment. Heart failure and dental implant procedures carry risks that vary by individual health status. Always consult your cardiologist and dentist before making decisions about dental implants or other treatments. The information provided is based on general evidence and may not apply to all cases. Dental implants are a popular and effective solution for replacing missing teeth. For patients with heart failure, key questions arise: are implants safe? Can they interfere with heart-related imaging tests like MRI, CT, or echocardiograms? How does aging affect the decision? This article provides clear, practical guidance to help patients with heart failure understand their options and make informed decisions, supported by peer-reviewed evidence. (1) Safety of dental implants in heart failure patients. Dental implants are not automatically contraindicated for heart failure patients, but their safety depends on several critical factors, as outlined in Guidelines for Cardiovascular Dental Management. 2. What heart failure means for dental implants. Heart failure means your heart has trouble pumping blood effectively, which can affect your body's ability to handle surgery or heal afterward. If your heart failure is mild and stable, e.g., you manage daily activities with minimal symptoms like fatigue or shortness of breath, dental implants may be safe with proper planning. If you have severe symptoms or recent hospitalizations, your doctors may recommend waiting until your condition stabilizes. Your cardiologist and dentist will work together to assess your heart stability, review your medications, and ensure the procedure is as safe as possible. For example, they'll check if you need antibiotics to prevent infections or adjustments to blood thinners to control bleeding. 2. Factors influencing safety. Medical stability. If heart failure is well controlled, e.g., NYHA class 1 to 2, no recent hospitalizations, stable on medication, implants can typically be placed safely. Unstable symptoms, e.g., shortness of breath, swelling, fatigue, warrant postponing elective dental surgery to avoid cardiovascular complications. 2. Type of anesthesia. Implant placement typically uses local anesthesia, which is safer for heart failure patients than general anesthesia. Sedation, if needed, must be carefully selected to minimize cardiovascular stress. Vasoconstrictors, medications that narrow blood vessels, like epinephrine, are contraindicated in uncontrolled heart failure. 2. Infection risk. Implant surgery can introduce bacteria into the bloodstream. Antibiotic prophylaxis is required only for high-risk conditions, such as prosthetic heart valves or a history of infective endocarditis, per American Heart Association, AHA, and American Dental Association, ADA, guidelines. Routine prophylaxis is not recommended for most heart failure patients. 2. 6. Medications. Blood thinners, e.g., warfarin, direct oral anticoagulants, aspirin, increase bleeding risk during surgery. Low-risk procedures can often proceed without interruption, using hemostatic agents. 2. Diuretics and other heart failure drugs may affect hydration and electrolyte balance, requiring careful monitoring. They can cause dry mouth, xerostomia, complicating oral health. 2. Healing capacity. Circulatory impairment and heart failure can slow oral healing, increasing the risk of post-surgical complications due to impaired collagen synthesis and macrophage function. 5. What are the chances of success? Studies show that dental implants have high success rates, 90 to 95% or higher, in well-managed cardiovascular patients, including those with stable heart failure, when proper precautions are taken. 5. 7. Complications, such as excessive bleeding or infection, occur in less than 5% of cases in general implant patients, but these risks are higher if you take blood thinners or have unstable heart failure. 5. For elderly patients, the risk of future implant issues, e.g., gum infections or implant loosening, increases if heart failure worsens over time, which is why your dentist may suggest alternatives like dentures for long-term safety. 5. Implants versus dentures or bridges, what's right for you? Dental implants are fixed in your jaw, offering a natural feel, better chewing ability, and durability, often lasting 10 to 20 years with proper care. However, they require surgery and may need maintenance, e.g., treating gum infections, later, which can be risky if your heart failure worsens. Dentures are removable devices that replace missing teeth without surgery, making them less invasive but potentially less comfortable. They may slip, require daily cleaning, and need replacement every 5 to 8 years. Bridges, which attach to nearby teeth, are also non-surgical but may not last as long as implants, 5 to 15 years, and can affect adjacent teeth. Your dentist can help you compare these options based on your heart health, lifestyle, and budget. For example, if you have severe heart failure or prefer a simpler solution, dentures or bridges may be better. Option. Pros. Cons. Best 4. Dental implants. Natural feel, durable, 10 to 20 years, strong chewing. Surgical procedure, higher cost, potential maintenance risks. Stable heart failure patients, younger patients. Dentures. Non-surgical, lower cost, removable. May slip, less comfortable, replaced every 5 to 8 years. Elderly or severe heart failure patients. Bridges. Non-surgical, fixed, moderate cost. Affects adjacent teeth, lasts 5 to 15 years. Patients wanting fixed but non-surgical option. Considerations for older adults. Heart failure is often progressive, particularly in elderly patients. While implants are permanent and effective, they may require future maintenance or corrective procedures, e.g., treating periimplantitis, replacing failed implants, or adjusting prosthetic components. For elderly patients with progressive or severe heart failure, e.g., NYHA class 3 to 4, these procedures may pose significant risks if their health declines. Less invasive alternatives, such as removable dentures or bridges, may be safer and more practical, though they have drawbacks like reduced chewing efficiency or discomfort. In stable, healthy elderly patients, e.g., NYHA class 1 to 2, implants may still be viable with proper planning. 5. Do implants affect imaging results? Heart failure patients frequently undergo advanced imaging. Dental implants can influence the accuracy of certain scans, depending on the imaging modality and implant characteristics, primarily causing localized artifacts in head and neck regions. 1, 3. MRI. Safety. Titanium and zirconia implants are non-ferromagnetic and MRI safe, posing no risk during scans. 1. Possible issues. Implants may cause artifacts, e.g., signal voids or distortions, in MRI scans of the head, face, or jaw. The severity depends on implant material. Titanium causes fewer artifacts than older metal alloys, the number of implants, and MRI field strength. Chest and heart MRIs are almost never affected, as implants are outside the typical imaging field for cardiac studies. 1. CT scans. Artifacts. Implants can cause streaks or distortions in CT scans of the jaw, sinuses, or neck, with severity varying based on implant material, number, and CT slice thickness. 3. Heart and chest CT angiography. These scans are typically unaffected, as implants lie outside the field of view. 3. Carotid or brain CT angiography. Artifacts may overlap with blood vessels, potentially compromising the evaluation of stenosis or blockages. 3, 4. Echocardiography and ECG. No effect. Dental implants do not interfere with ultrasound-based echocardiography or electrical-based ECG measurements, as these are unaffected by oral metals. Why this matters in heart failure. Heart failure patients often require imaging of multiple vascular regions to assess risks like stroke, from carotid artery stenosis, or heart attack, from coronary artery disease. Implant-related artifacts in head or neck imaging could delay diagnosis or treatment of these conditions, though chest scans remain clear. 4. Specific imaging needs include coronary arteries, aorta, pulmonary arteries, chest CT angiography. Implants do not interfere. 3. Carotid arteries, brain vessels, neck or brain CT/MR angiography. Implants may reduce clarity, complicating vascular assessments, but less so with titanium compared to zirconium. 4. Radiologists can mitigate these issues by using metal artifact reduction (MAR) software, effective in 98% of cases. 3. Adjusting scan protocols, e.g., optimizing slice thickness or MRI sequences. Employing alternative tests, such as carotid ultrasound or MR angiography. How to decide if implants are safe for you. Considering dental implants with heart failure. Follow these steps to make an informed decision. Talk to your cardiologist. Ask if your heart failure is stable enough for surgery. They may assess your heart function, e.g., ejection fraction, often above 40% for stable patients, or adjust medications like blood thinners. They'll use the New York Heart Association (NYH) classification, Class 1, mild, no symptoms during normal activity, Class 4, severe, symptoms at rest, to gauge your risk. 2. Consult your dentist. Discuss your heart condition, medications, and implant procedure details. Ask if antibiotics are needed to prevent infection. 6. Evaluate your symptoms. If you have frequent shortness of breath, swelling, or fatigue, implants may need to wait until your condition improves. Consider your age and future health. If you're older or your heart failure is likely to worsen, ask about non-surgical options like dentures or bridges. 5. Plan for imaging needs. If you need regular head or neck scans, e.g., for stroke risk, discuss how implants might affect imaging clarity with your radiologist. 4. Weigh costs and benefits. Implants cost $3,000 to $5,000 per tooth in the U.S., while dentures, $1,000 to $3,000 for a full set, or bridges, $2,000 to $5,000, are less expensive. Check with your dental insurance or Medicare/Medicaid to see what's covered. Implants may not be fully covered. Discuss payment plans with your dentist. 5. Bottom line. Safety. Dental implants are safe for heart failure patients with stable, mild disease, e.g., NYHA Class 1 to 2, and cardiology clearance, provided precautions address bleeding risks, infection, with antibiotic prophylaxis for high-risk conditions only, and anesthesia. Success rates exceed 90 to 95% in well-managed cases. 7. Imaging. Implants do not affect echocardiograms, ECGs, or chest CT angiography but may cause artifacts in head/neck MRI or CT scans. Radiologists can often mitigate these with specialized techniques or alternative tests. 1, 3, 4. Elderly patients. For those with progressive or severe heart failure, e.g., NYHA Class 3 to 4, long-term risks are higher due to potential implant complications, e.g., periimplantitis, implant failure, and declining health. Dentures or bridges are often safer and more practical, though implants may be considered in stable, healthy elderly patients. 5. Clinical importance. Clear imaging is critical for heart failure patients to assess stroke and heart attack risks. Implant-related artifacts in head/neck scans could delay critical diagnoses, but cardiac-focused scans are unaffected. 4. Common questions from heart failure patients. Will the implant procedure be painful? Local anesthesia numbs the area, so you should feel little to no pain during surgery. Mild discomfort, e.g., swelling or soreness, is normal afterward but can be managed with medications safe for your heart condition. 2. How long is recovery? Most patients recover within 1 to 2 weeks, but healing may take longer if heart failure affects blood flow. Your dentist will monitor your progress to ensure proper healing. 5. Can implants affect my heart medications? Implants themselves don't interact with medications, but your dentist may coordinate with your cardiologist to adjust blood thinners before surgery to reduce bleeding risks. 2. Will implants cause problems with my heart scans? Implants don't affect heart-specific scans like echocardiograms or chest CT angiography. They may cause minor distortions in head or neck scans, but radiologists can often adjust techniques to get clear images. 1, 3, 4. What if I need implant repairs later? If your heart failure worsens, future dental procedures, e.g., fixing gum infections or replacing implants, may carry higher risks. Discuss long-term plans with your dentist, especially if you're elderly. 5. Conclusion. Dental implants can be a viable option for stable heart failure patients with careful planning and cardiology clearance. However, for elderly patients with progressive or severe heart failure, less invasive solutions like dentures or bridges are often safer, more practical, and better aligned with long-term health needs. Patients should consult their cardiologist and dentist to weigh the benefits and risks based on their individual health status. References.